Brian Campbell again. We're going to show you here some exercises you can do for the rotator cuff to strengthen it while also engaging the core and the hip. We're going to use a cable column here, and Dr. Lena will grab the handles. And before we do anything, I'm just going to have him engage the core and the hip in the starting position. So a mini squat. Again, like he had said in the previous video, tightening the abs and core. And then from here, what I'm going to have him do is keeping the elbows straight. I'm going to have him squeeze his shoulder blades together. This is working the scapular stabilizers, which run around the shoulder blade. They give the whole shoulder girdle stability, as well as the rotator cuff. And I'm going to have him do 2 sets of 10 of these.
And it's important that the eccentric, so concentric is when the muscle is shortening, so that's going to be a count of 2. The eccentric is going to be a count of 4 as the muscle is lengthening. It's much more important to work the eccentric side of the muscle because that works your fatigue resistance.
And then the other thing you want to not do with this is shrug your shoulders. In other words, you want to keep the upper trapezius, this part, relaxed and really focus on the muscles in between the shoulder blades as you bring the weight back. All right. So then from there, we'll go on to kind of a progression of the exercise. This will be almost like rowing a boat. So what I'm going to have him do is pull the cables, bend his elbows, and again, he's going to focus on squeezing the muscles between the shoulder blades as he comes back. Again, not shrugging the shoulders, keeping the upper trap relaxed. And we'll do 2 sets of 10. Okay. All right, then I'll have him turn and we'll face to the right, and we'll grab the band there. These 2 exercises will actually be for the posterior rotator cuff or external rotation. What I'll have him do, keeping the elbow by the side, is rotate out and then back. A nice slow controlled movement, keeping that elbow nice and close to the body. Okay. All right, then I'm going to have him grab the cable on the other hand, and this will work the subscapularis or the anterior rotator cuff. Again, same thing. We'll keep the elbow by the body, and this time I'll have him rotate the hand inward toward the stomach, and then back. And I'll have him grab both handles. And this time what I'm going to have him do, keeping the elbows straight, is pull the cables right down to the sides of his waist like that. Focusing on again, the periscapular muscles on each side.
And engaging the core at all times. It's really what I want you to do. Every exercise you do, engage the core.
Then I'll have Dr. Lena face the other way. And what we're going to work here is, again, the scapular stabilizers. In this case, the protractors, which are the muscles that bring the shoulder blade outward. So I'll have them grab the handles on both sides there. Okay, and then I'll have him straighten the elbows out and come forward in front of the body. Essentially, from this position, round the shoulders forward, almost like he's throwing a punch. And all the way forward. Good. And as he's coming forward, again, that's working the serratus anterior, one of the scapular stabilizers. Again, as he's doing this, important keeping a tight core, keeping the hips engaged, again, because that is the center of your base, your strength base.
So these exercises can be very important for you to try and prevent the rotator cuff injuries or to try and recover from the rotator cuff surgery. So you really want to get that core strong, you want to get the periscapular space strong, and the rotator cuff muscle strong. And it's really the anterior and posterior muscles that will help hold that head down and prevent you from getting a rotator cuff tear in the first place or again.